Hey there, I'm Doc Sholo, and today I'm going to talk about the veterinarian client patient relationship. Okay, so what is the veterinarian client patient relationship, otherwise known as a VCPR? Okay, this exists when a veterinarian is responsible for providing care for a client's animals, and the client is willing to accept the advice of the vet. Okay. This relationship is formal and long term between the veterinarian and the client, and usually comes as a written consent form signed by both veterinarian and client. Okay. This also serves as a foundation for quality veterinary medicine and animal care. For the client, it ensures they have access to safe medication and treatment. Okay, so a VCPR has to have the following, or has to have met the following considerations. So the veterinarian assumed the responsibility for making clinical judgments regarding the health of animals and the need for medical treatment. And the client has agreed to follow the veterinarian's instructions. Also, the veterinarian has sufficient knowledge of the animals to initiate at least a general or preliminary diagnosis of the medical condition of the animals. Okay, let's just talk about the first one. Okay, so the veterinarian, okay, he has to assume the responsibility, okay, for providing treatment to the animal. Okay, he can't be reluctant. Okay, he has to accept the case. And when he does accept the case, the client has to agree to follow the mode of treatment that the veterinarian is prescribing. Okay, also, the veterinarian has to have knowledge of the case. Okay, for example, he's just basing it on a message. Okay, the veterinarian has not seen the animal for a while now. Okay, and then the client is reporting that the animal is showing such symptoms. Okay. Then this has to be rectified. The veterinarian has to at least see the animal to have knowledge of its condition. Okay, so how does the vet do this? Okay, right. As mentioned, the vet has to have recently seen the animal and is personally acquainted with the keeping and care of the animal by virtue of examination or by medically appropriate and timely visit to the premises where the animals are kept. Okay, so for this relationship, a VDO is important. Okay, so what is a VDO? VDO, or veterinary drug order, this is a written instruction, a prescription to the pharmacist or a veterinary drug establishment to fill a veterinary prescription of large quantities of a specific veterinary drug and product, provided that there is an accompanying VCPR letter from the prescribing veterinarian. Okay. So a VCPR is required when prescribing for 10 or more animal units. Okay. So why is VCPR important? A trending topic nowadays is antimicrobial resistance, or AMR, and drug contamination in the meat as well as milk that we consume fall under this concern. Okay. VCPR is important in drug residue prevention of edible animal products. Okay. Okay, so drugs, they must be used properly. And this responsibility falls heavily on the client who raises the animal and sells its products. Okay, so the consumers, or those who buy these products, they have to put their trust in the farmers. Okay, and with this, farmers have to practice due diligence to produce safe and uncontaminated products. Care must also be given to the environment and also when treating animals. Okay, so why do we need to be careful on the use of antibiotics? It is because the use of contaminated products does not come without problems. As an example, milk contaminated with antibiotics, this may initiate an allergic reaction in some people. Its presence, or the presence of antibiotics, may also inhibit the growth of beneficial bacteria, which is essential in yogurt and cheese making. Another problem is a decrease in the effectiveness of antibiotics when treating animals and people. Okay? And this is due to antibiotic resistance. Alright, so how do we go from here? To get started on Vcpr, client needs to talk to the veterinarian to ensure that there is a Vcpr in place. Alright, after that, the particulars of the Vcpr, it has to be discussed between the client and the veterinarian. Okay. In this discussion, the client has to ask relevant questions and details have to be covered. And then, the rules and regulations about drug management practices are dynamic. Hence, it's important to have current updated information. Now, how to have current updated information? Okay. A client talking to a veterinarian will help to achieve this goal and will be properly advised as to the use of medications or those medications that they have in stock. Okay, so here are the frequently asked questions. Does the Vcpr exist between vet and client at all? Okay, to provide clarity on this question, how to prove that there is a Vcpr between a vet and a client? Okay, to do this or to address this, it must come in a written consent form signed by both the veterinarian and the client. Alright, next question. Does the client and the vet understand and have the same expectations about the Vcpr? Okay, to address this question, there has to exist a discussion of all the drugs and the treatment to be done by the veterinarian and the client. Okay. Going into a discussion will provide instructions as well as the particulars to the client who is about to use the medication. Okay, can the veterinarian go out to inspect the farm on a consistent basis? Okay, this question is important because part of the Vcpr is for the veterinarian to have an idea of the facilities where the animal is reared. Okay, and this is important for him to make a proper diagnosis as well as prescribe an appropriate treatment for the animal. Okay, so next question is, does the client follow the veterinarian's advice? Okay, this is addressed by the veterinarian actually going to the animal facilities and doing a follow-up or checking the animals. Okay, next, does the client have animal treatment protocols? Okay, so this question is important. So, what is an animal treatment protocol? Okay, This is a written document which is important in VCPR. The benefit of this is that this serves as a guide which ensures all drugs used on the farm are legal, and this helps to avoid drug residues due to overdosing or exceeding injection site limitations. A consideration is also that drugs have to be administered according to the label or per the veterinarian's instructions to avoid underdosing, which may lead to antibiotic resistance. Alright, so what about the extra label use of drugs? So the veterinarian inquires if the client does extra label use of drugs, because extra label use is highly regulated in food animal medicine. Using drugs in this manner, this may produce longer withdrawal periods and residues. Okay, so all drugs used on the farm have to be inspected and discussed for the veterinarian to detect when a client is using an over-the-counter drug in an extra label manner. Okay, so if extra label use cannot be avoided, then the veterinarian has to approve and must properly label the over-the-counter drug with an extra label drug use, and also properly inform the client on the extension of withdrawal times for milk and slaughter. All right. So we can all benefit from all of these good practices, and we can uphold effectiveness of antibiotics through proper utilization. Therefore, we must work on having a thorough discussion with our client in the context of VCPR. Thank you for your attention.